with Dr. Patrick Choyce, February 7th, 2020. The student here is Sarah Lee, and my name is KJ, and let's go ahead and introduce you, sir.
Hi, I'm Dr. Pat Choyce. I am the founder, owner, and medical director at All Pets Animal Hospital and 24-hour emergency care in Katy, Texas.
Perfect. Who would you say are your patients?
Our patients are dogs, cats, and exotic companion animals, which would include birds, reptiles, amphibians, pet pigs, pet goats, ferrets, hamsters, hedgehogs, you name it.
All the things.
That's right.
What are some common conditions that require prescriptions for your patients? Can you name 5 to 7?
5 to 7. Well, let's go by classes of prescriptions. First would be anti-parasitic agents for particularly ectoparasites, fleas and ticks, and internal parasites such as protozoa organisms, roundworms, hookworms, whipworms, and other nematodes. Then we have antimicrobials to treat different types of infections. This can be topical and or oral and or injection. And this would be antibiotics, antifungal, anti-yeast medications. Then we have medicines for pain and inflammation. This could be non-steroidal anti-inflammatory agents. It can also be opiate type medicines such as tramadol or other medicines such as gabapentin, a neuropathic agent. Then we have medicines to treat allergies, which can include corticosteroids, antihistamines, and new special medications such as monoclonal antibody therapy, or what's called Cytopoint, and other medications that block the allergic reaction. Then we have nutritional supplements that we might want to dispense. That can include an amino acid to keep the urine acidic so that we don't have the risk of increased infection or struvite stone formation in the urinary tract. Is that 5 or we need some more categories?
That's good. That's perfect.
Good.
Thank you. What are the 5 most common medications you prescribe in the clinic, and do any of them require compounding?
Some do require compounding. First would be the anti-parasitic agents, which would particularly be heartworm preventative and flea and tick prevention and intestinal worm prevention. Then we have the antimicrobials, which are antibiotics, antifungal agents, which can be injectable, oral, or topical. And some do require compounding. For example, if we have a cat with ringworm, we usually want to treat with itraconazole, and we will have that compounded by a veterinary pharmacy, which can be done online or through one of our local veterinary compounding pharmacies.
Perfect. Do you have somebody who currently compounds these medications in your practice?
Yes, we use Specialty Veterinary Pharmacy, we use BCP Pharmacy, Roadrunner Pharmacy, and also Covetous Internet Pharmacy. All these pharmacies are regulated and provide excellent quality compounding for medications. For example, with SVP or BCP, we need to have apomorphine, which is a opiate medicine that induces vomiting. It's very safe, short-acting, and effective. And when we have animals that might be poisoned, we need to give them apomorphine intravenously. This is not readily available for ordering for a veterinarian, so you usually have to have it compounded by a local veterinary pharmacy.
Perfect. So there's no one specifically in the clinic you outsource your compounding?
Yes, we do outsource to SVP, to BCP, Covetous, and let's see, I think those are the main ones, Roadrunner also.
Sure.
Now we will sometimes, in a pinch, need to mix things up in the clinic. For example, we have a fruit-flavored syrup, and if a small exotic pet comes in and say it needs doxycycline, we'll have to mix some doxycycline, open up the capsule, mix it in a fruit-flavored syrup, and help that be dispensed to the pet.
Great, okay. Do you work with any retail pharmacies such as CVS, Walmart, or Walgreens?
Oh, absolutely, all the time. Just for example, right now we have a dog in the hospital who's suffering from autoimmune hemolytic anemia, and this pet needs to have Plavix to prevent thromboembolism. It also needs to have amlodipine for high blood pressure, and azathioprine to suppress the immune response. All of these we called into CVS and right up the street, and we were able to pick them up. Typically, I'll write prescriptions for clients to pick up at local pharmacies where they can get the products for a lower price, and sometimes I don't have them in stock.
Perfect. Okay, for somebody who wanted to enter the field as a veterinary pharmacy or a technician, what type of experience or educational background would you recommend?
Well, certainly they want to go to their pharmacy training as a pharmacy tech or to pharmacy school. At the same time, I strongly recommend that they shadow and work in a veterinary hospital to understand the veterinary industry. Obviously, anytime you're getting exposed to a new profession, you're like a white canvas that's getting painted on, so you want to find a high quality facility that has high ethics and high quality standards. And so if somebody is interested in being a pharmacy tech or a licensed veterinary, a pharmacist that specializes in veterinary medicine, it would be good that they consider not only the shadowing, but maybe also becoming a licensed veterinary technician at the same time, which can be done online. This would involve working in a veterinary hospital for a period of time, but it would give a good foundation and background for this individual to understand the veterinary industry. Also, there's a specialty pharmacy at Texas A&M College of Veterinary Medicine nearby where there's a registered pharmacist there. That would be a good place for a pharmacist or pharmacy student to go and shadow and mentor and develop their professional network. Certainly we offer shadowing here at All Pets Animal Hospital. The other thing I like to mention is to get the PLUMS app. PLUMS is a veterinary formulary textbook. I'll hold it up. This is one of the more recent editions right here. It has all the different drugs that we use in veterinary medicine. Then also you could get the PLUMS app. So I use this all the time in my clinical work because I need to know if there's any drug interactions with other drugs the pet may be on, or if there's any toxicities or anything like that. So this is a great app. It's not very expensive, and everybody has a smartphone today, so I use this constantly. So if I've got multiple drugs I'm putting a pet on and adding a new one, I'm going to look up this drug and see what interactions there are and side effects, and that way I can be up to date.
Perfect, okay. Do you currently have any specific veterinary pharmacy technicians working for you?
We have licensed veterinary technicians. We do not have any specific veterinary pharmacy technicians. I will say there is a big need for that. For example, in our practice, we could certainly employ a skilled licensed veterinary technician to manage our pharmacy, all of the refills that we do. They could help fill prescriptions, and they could also work as needed as a veterinary technician. And so I could see in a practice like ours that has 45 staff members, 8 doctors, and is open 24/7, where having someone like that would be very important. So the larger the practice, where there's multiple doctors or a large specialty practice, they would need a pharmacy technician. Typically, these positions are filled by licensed veterinary technicians that want to specialize in pharmacy.
As a 24-hour hospital ER, do you obviously need to have emergency medications on hand? What are the most common emergency medications?
One I just mentioned is apomorphine to induce vomiting. So lots of times pets will ingest something toxic like rat bait or the owner's medications like a bottle of ibuprofen, which is going to be toxic, and we need to induce vomiting as soon as possible. The most effective product in veterinary medicine is apomorphine, and that has to be compounded, and we need to have that readily available. There are other emergency drugs that we don't use that often, but use periodically, and that would include like antivenom for snake bites. We also have other specialty drugs, calcium gluconate, we'll have potassium phosphate, all kinds of different special medicines that we will need periodically, maybe just once a year, but we still need to have in stock in the event of an emergency when a pharmacy is not open. So we are members of the Veterinary Emergency Critical Care Society, and VetX sets the standards for emergency care in our industry, and they have a list of all the drugs that a practice should have, and so we order those drugs and have them in stock, and then we monitor their expiration dates and replace them as necessary.
Has technology impacted how you prescribe medication?
Absolutely, and just as I showed you my iPhone with my PLUMS app, that's huge, and then we use online pharmacies so that we can help clients save money and get the prescriptions that they need through online. So we use Covetous Online Pharmacy, where we'll have multiple prescriptions every day that we send to Covetous. They then email the client, and the client can have the product shipped to them. This also affords a lot of savings for the client, and it enables us to not have to stock so many things in the clinic. we're basically a medical practice and not so much a pharmacy, although we have to have a pharmacy. And if you stock too many medicines, you have all your cash tied up in your pharmacy, and that can paralyze the profitability or the cash flow of your practice. You typically want to move your products every 30 days. Some things, obviously, like anti-venom, are going to stay in the refrigerator longer, but most of your products need to be rotating every 30 days. If you have something that a client needs to have long-term, then helping them save money by purchasing it online is always a wise decision.
Those are some great points.
So,
Have you ever experienced any mistakes made by any of your outsourced pharmacies?
not typically. Most of them are very, very conscientious. Sometimes the local pharmacies that are very busy will not use closed communication. What I mean by that is, if I say, doctor, I need cephalexin 500 milligram number 30, one every 8 hours for the next 10 days with one refill, they say, thank you, doctor, I'll go ahead and do that, and they write down cephalexin 250 milligram. Had they called it back to me and said, doctor, that was cephalexin 250 milligram, I says, no, pharmacist, it was 500. So you need that closed circle communication.
Okay. As a medical director, what would you say has been the most challenging thing for you in regard to prescribing patients medication?
Most challenging thing, that's a good question. I would have to say that being sure that the client is properly educated on how to administer the medicine. We're dealing with animals. For example, the first pet I ever had was Mr. Peeps. He was a wild cat, and I went to the vet, and he had ear mites. So the vet gave me these ear drops to put in there. And I said, well, doctor, this is Mr. Peeps. He likes to bite and scratch. And he says, how do I do it? Oh, just wrap him up in a towel, and you'll just squirt him in there. Well, I wrapped Peeps up in a towel. He clawed me to death, and the drops got in his eye and irritated his eye. So owner compliance is very important. So we have to take that into consideration when we prescribe. For example, a senior citizen needs a special type of vial to take her pills out. And if we're dealing with some senior mental issues like partial senility and forgetfulness, then we have to be sure there's somebody at home that can collaborate to give the pet the medications.
Good points, good points. So do you have any ideas or what you would want to see in the future of veterinary pharmacies?
Wow, that's a good point. In our practice, what I would like to see ideally would be a drive-through. It's an architectural issue, a drive-through where people could pick up their prescriptions with a little overhead, for rain and things like that. Then I also would like to see where we could electronically send our prescriptions into a local pharmacy. I know local, human doctors do that now, but I haven't seen where that's set up for
so you wouldn't have to
veterinarians.
call.
Right, because calling, the pharmacist is busy, I'm busy, and there could be a verbal or listening miscommunication. If no close communication takes place, there's high room for error. So being able to send these things in digitally, like physicians do, would be great. The other thing would be in the hospital, I think it would be better to have a little separate cubicle where there's a room with a Dutch door, and the only person that can go in there is the pharmacy tech, and then people would come and get their prescriptions here. Here, multiple people can go by our pharmacy shelves and pick things up. And not that I don't trust my staff, they're all good people, but historically and statistically in veterinary practices nationwide, there's about a 5% theft rate where people will grab prescriptions and take them out the door. The other area where technology will help is like with our controlled substances. We use a Cubex system, which is similar to the Pixel they have in the hospital, and all of the controlled drugs are managed through that system, and it's highly accurate. They also have these units for all of your non-controlled items, such as your pills and your ointments and topicals and things, and you can take care of your inventory that way. But that technology is yet to come. It's expensive, and some of the larger practices that have put a whole Cubex system in, it's been pretty much a financial and time management nightmare. But the controlled substances work quite well with the Cubex system. We also have a new product called Q-Buds, where if you have a lot of white goods or certain stock items, every time you take one out, you hit the Q-Bud, and that helps the inventory manager know when to reorder and keep track of everything.
Awesome. And then finally, do you have any wisdom that you would want to pass on to a future pharmacy technician that wants to specialize in veterinary medication and compounding?
Well, what I tell everybody is consider yourself a white canvas that's going to get painted on and get as much exposure as possible. I would recommend shadowing different hospitals. You can shadow here. You can shadow at some specialty practices where they have a pharmacy tech. Visit Texas A&M, get to know their pharmacists, shadow for a day. Join local, veterinary medical groups, technician groups, practice management groups, and develop your professional network. Get on LinkedIn, get a professional profile, put what you're interested in, and just get to know a lot of different people so that that white canvas has a lot of things painted on it to give somebody a good foundation. It's always important to have some kind of mentor, somebody that cares about you and wants to see you succeed, so you want to look for those kinds of people.
That's great advice. Great advice. I think that was it. Anything else, Sarah?
Okay.
No, thank you.
Okay, very
All
good.
right. Thank you so much, Dr. Choyce.
You're welcome.